Knowing if someone contracted the Delta variant isn't easy. KVUE's Darrenisha Heron spoke with local health officials and an infectious disease expert to find out why. Darrenisha?
Quita, the short answer is public health officials say that type of testing is limited because it's expensive. So right now the state handles it and only accepts samples from hospitalized patients or patients who died.
Experts say the Delta variant is more contagious than any other. Monday, Austin Public Health reported 28 confirmed cases in Travis County. So why is that number so low when we're seeing an average of 668 new cases per day in the Austin metro area? A Texas infectious disease specialist says not every COVID test is checked for variants.
All of these tests are sort of samples. And so, for example, let's say you're averaging 700 positives a day in Austin. They're probably only sending off 7 to 10 of those to a lab that does a sequencing, and then that data is sent to the CDC.
Austin Public Health says because variant sequencing technology is so costly, a state lab does it, and it only accepts samples if the patient was hospitalized or died. And those tests take time to verify.
The simple answer is if you're really worried and you haven't been vaccinated, I think it is time to get vaccinated. If you've already been vaccinated, the bottom line up front is that the vaccines are protecting you against hospitalizations and death.
The CEO of Texas Nurses Association agrees.
99.6% of people that are hospitalized for COVID are unvaccinated.
Cindy Zolnirik says knowing that some of these hospitalizations could have been prevented with the vaccine, morale among nurses is low. And that's not helping hospitals keep nurses on staff.
A nurse recently said to me, I am watching my patients slowly die. And right now, they're young patients that normally would recover from an illness, and they're not.
That's a tough reality to face every day. An APD spokesperson told me that state and national data proves that the Delta variant is the most common right now. And they say no matter what variant you have, the treatment and recommendations do not change. Quita, Brian.
All right, Darrenisha Heron live for us in the newsroom tonight. Darrenisha, thank you very much for that.